Hello and welcome to Focus 54, your weekly guide into real African stories. I am your host, Jabulani Tulani Kumalo, and on this week's episode, we are looking into the annual International Conference of Public Health in Africa that just ended on Thursday. This conference provides a unique African lead platform for leaders across the continent to reflect on lessons learned in the health science, aligning on a way forward for creating more resilient health systems. This year's conference runs under the theme Breaking Barriers, Repositioning Africa in the Global Health Architect. But firstly, let's take a look at these stories that are making headlines across the continent. We kickstart with Mozambique as it unveils its ambitious 8 billion groundbreaking energy transition plan set to Spain until 2050, with the goal of securing investments totaling approximately 80 billion. The comprehensive strategy aims to propel the nation towards a more sustainable future for enhancing renewable energy capabilities and ensuring wider energy availability. We move on to South Africa as hundreds of people join a pro-Palestinian march in Johannesburg on Wednesday. Members of the public, political parties, civil servants, organizations and other supporters marched through the streets of Johannesburg demanding a permanent ceasefire in Gaza as they marked the International Day of Solidarity with the Palestinian people. And we move on to Cameroon as the country is set to administer malaria vaccine in 2024. This comes after the United Nations had held on Wednesday the forthcoming scale of malaria vaccine across Africa after the first shipment of doses arrived in Cameroon. Since 2019, more than 2 million children have been jabbed in Ghana, Kenya, Malawi in a pilot phase, resulting in sustainable reduction in severe malaria illnesses and hospitalization. Now the scheme is moving into a border rollout. This is all we had for you in the segment. Please join us in the next segment as we go deeper into the topic of today. Welcome back to the second segment of Focus 54. Now I'm joined by health experts Ratlo Tamatorwa and Tafazwa Jawara. And they're in the studio with me right now. And I am pleased to welcome you to the show.
Thank you so much.
Thank you so much.
Thank you. So maybe I'll start with the first question with you, Mr. Matorwa. What is the significance of the conference that was held in Lusaka, which is the Conference of Public Health in Africa?
Okay, thank you for that question. I think I have to start with maybe making the viewers know what this conference is all about.
True.
Conference of Public Health in Africa is a gathering of public health experts across Africa where these experts meet annually to share and deliberate on the state of public health in Africa. One of the key objectives of that conference is to share information and also come up with the best practices that can take the agenda of public health ahead. You would understand that Africa is actually in a situation where we are confronted with many issues that affect public health currently.
Yeah,
so this is the platform where the who's and who in the public health fraternity meet to discuss how to take the public health agenda forward.
Okay, thank you very much. And what are the primary health infrastructure challenges in Africa that hinder the continent's ability to compete global in a field of public health?
I think there are many issues that are currently affecting Africa, but I would want to issue a disclaimer that whilst there are many issues affecting Africa, one of the things that I'm excited about is that Africans have really taken a position in terms of saying that they must confront their own problems. we can see this initiative of Conference of Public Health in Africa is one such positive initiative where we are saying we have a role to play when it comes to addressing our infrastructural challenges. At present, we are facing infrastructural challenges that ranges to issues to do with access to healthy facilities, for example. They are not widely within the 5-kilometer range that has been pegged by WHO. You understand that we also have an issue with specialized services. You can go to primary health care facility and it's very difficult for you to get a CR scan or just an ordinary scan or some radiology services. You can't get there. Nutritionist may also not be within the vicinity, for example, to advise mothers on how to feed children, for example. True. So we are having a lot of issues that are affecting our access to health. When you also talk about issues to do with facilities that promote health and well-being of the citizens, also look at issues to do with access in terms of skills. Because you can have an infrastructure, but if that infrastructure is not supported by adequate skills, you actually have a problem there. So you go to a hospital where you find that one doctor is serving, maybe in an example of district of Cholocho, for example, that one doctor is serving 8 hospitals, which is very difficult for that person. Our road network itself, they're also a cause of concern when it comes to access to health care. We are also talking about our testing capacity itself. Do we have enough testing infrastructure? I'm sure you are aware that there are diseases that need confirmations of laboratory tests. How accessible are these laboratory tests? So we need to do a lot of evaluation of our public health infrastructure and fill in the gaps in order to enhance access to health in this country or in Africa per se.
True. But any progress on any of the mentionables that you mentioned, for example, for the doctors, we have a situation of doctors whereby we don't have skilled doctors. You mentioned it, right? Any form of movement, anything, any improvement into that, anything that is being implemented to hinder that? I would take it to you, ma'am.
Yes, definitely. The Ministry of Health and Child Care and all the public health players in the country have been doing quite a lot. Took off the initiative of the that is ongoing. I understand a few districts are already rolling on what we call the community health strategy, which is trying to address the issue of proximity to your healthcare facility. So they want to try and to do what we call the health posts, so that health is accessible to people within their village, not just within their ward. And also, you talked about skills. We would want to acknowledge the cadres that are on the ground when we talk about primary health care, who are called the village health workers, which is why, as Public Health Association of Zimbabwe, we feel that they have a special place because they are actually playing a very important role, especially in outbreaks, the just ended or the ongoing pandemic of COVID-19, malaria. They're the first people that are to attend the patients before any help has gotten to them, and they have managed to save a lot of lives. Then there is also the outreaches that are ongoing. I understand Ministry of Health is the parent ministry that has been holding that, and it's an incredible effort that they've been making, because what happens is at the outreach is all these skills are put together. These people, they come in together, the nurses, the doctors, the nutritionists, everyone who is important is part of that team, and they go to those hard to reach communities to offer health services nearer to them. So I would like to applaud the efforts that have been happening, especially these issues to do with the outreaches, the health posts, and of course these issues of public health now encompassing not just the medical fraternity, but all people that are essential to public health, including even yourselves as journalists,
Yes,
so that's progress. It means that we are going somewhere, and we'll surely be able to
I think on that, whilst we're still on that, I appreciate that Jawari, you've tried to address this issue from the Zimbabwean perspective. But let's look at it overall, regionally in Africa. One of the challenges we are facing in Africa as a whole, this is not peculiar to Zimbabwe or Southern Africa per se, but the brain drain is affecting Africa as a whole.
There's a whole Africa.
So this conference, I'm happy that it's also looking at things to do with regional philanthropy, for example. It's also looking at saying what are the best practices we can proffer in terms of enhancing local solutions to our problems. One of the things that we can do in terms of enhancing provision of skills is to ensure that we prioritize healthcare in our fiscal budgets as Africa. I know we talk about the Abuja Declaration that talks about 15% to finance healthcare, but we may probably need to do more than that. We need to interrogate what is that which is attracting our health skills and healthcare to go to look for greener pastures elsewhere. That is a fundamental issue. Another issue is to look at how can we enhance our training capacity in terms of building skills. If we are able to do that as Africa and make Africa as attractive as even those in the north, we may be able to deal with issues to do with skills. Another issue that has been addressed in Africa is the issue of knowledge base. I'm sure you are aware that Africans are in the diaspora and they are performing wonders. Those who are providing the healthcare that we are really emulating today, to say countries like Norway, countries like Japan and South Korea are providing the best public health care. If you look at it, there are a lot of Africans that are involved in terms of the value chain. So we have knowledge when it comes, we have skills when it comes to that. You'll be very much aware, it may be interesting for you to know that a country like Uganda and Tanzania, University of Makerere, for example, is leading #1 when it comes to use of predictive science technology, where we are able to use the mathematical algorithms to detect the outbreaks of diseases, how much is needed for us to intervene. And by the way, in Zimbabwe, we have Harare Institute of Public Health. We also have that predictive science technology. So I think we need to know this level of capacity and also be able to come up with policies that acknowledges, recognizes, and trusts our local indigenous skills to actually help in intervening. So I think as Africa, we are getting there.
Yeah. All right, we'll take a short break on the segment and we'll come back right after this.
This is Focus 54, your weekly guide to real African stories. My name is Abigail Tembo and I'm in Lusaka, Zambia for the 3rd International Conference on Public Health in Africa, which is running under the theme Breaking Barriers, Repositioning Africa in the Global Health Architecture. Health ministers as well as experts are meeting here in Lusaka to discuss the way forward in as far as the health on the continent is concerned.
Welcome back to the Tech segment. I am still with my health experts as we move on. And this question is directed to you, Mr. Matorwa. So you were explaining that in Africa we have really educated experts who are going out there, making it big. Actually, some of them are well known in other countries, but they are our people.
Yes.
And what are we doing as a nation, as Africa actually, as a continent, to curb these situation of such brain drain?
Thank you. I think it's not a secret that what attracts our skills out there is also increased opportunities for livelihoods. We have to make our socio-political environment conducive. We have to ensure that we prioritize our health workers. In fact, we prioritize our skills.
True.
We make the environment conducive to have to retain our skills in the country and also create opportunities for growth. For me, I think that is the most important thing. You would find out that the space for professionals to grow is hindered in Africa, maybe because of issues to do with technology, issues to do with access to opportunities. So we need to enhance those opportunities for our people.
No, that's true. So how do you plan as an organization? How are we planning to hinder? Because we might say we need to plan. We might keep planning and keep on talking about this. This has been talked about. This is not the first time. And these things have been talked about more and more. People need to understand how. The how part is not coming out clear for people to understand.
Thank you, JB. I think I have the Secretary General for Public Health Practitioners Association who may be able to tackle that question and do justice to it.
Secretary General, please take this one.
Okay. How we plan is, being able to provide a platform for the academia world to be merging with the professional world. So that people are able to do their own researches. They are able to meet up even with university from the other universities from the global north. We've been working with Washington University lately through CPHIA. So those are some of the things that we are trying to make the professionals understand, because sometimes when they go out there, they'll say it's an opportunity for me to go and learn, explore, and become someone. Because in the public health fraternity, it's important that you're a practitioner, but it's also equally important that you become more of a researcher, because it's a novel kind of profession that revolves and changes every time and again. So issues are continually changing, which means you need a platform where people receive relevant knowledge at that particular time. We've become a global community and we cannot ignore that. So people really do need, in your own capacity as JB, you might not be able to say, how do I link with Washington University? They're doing this, and how do I make them know that I'm doing this? So you end up thinking that the only way is to go there and get noticed. But unfortunately, sometimes when you get there, you might not even get the opportunity still to showcase those skills that you had. So when you are still here, we are trying to make sure that there are linkages, even with public health journalists, public health practitioners, even the enthusiasts, the people that just feel that I have a passion in this place, I have something to do in this place. We are opening doors as an association to all those people so that they come together and meet. Networking is very important, but it's something that I think ever since the lockdowns happened, people just thought it's not as equally important. But sometimes, your breakthrough is just within the next person, and that person can be availed to you maybe within the next conference. So I would encourage even those that are public health professionals and feel that I've got what it takes and I want to move to the next level, to even attend the upcoming public health symposiums where the dates will be announced. If you're in Zimbabwe, you'll be able to attend it and understand what other experts are doing, and even see the opportunities that await you as a person, not just beyond borders, but maybe you can make it beyond borders whilst you're here in Zimbabwe. So the same way the people that are beyond borders at the global north are making it back here in Africa. We can also make it that side.
So we're trying to reverse the traction from there to the side.
Yes.
Okay, that makes a lot of sense.
One of the key things that is required for us to impact or to make changes in this, we want also governments in Africa to reduce their red tapes and bureaucracy, to become people-centered and to listen more to professionals in the field. I'm very happy with the current leadership in Zimbabwe.
Please, now you're taking it where I wanted you to take it.
Thank you so much. Maybe I jumped the gun. So I'm very inspired by the current leadership, the Minister of Health, which is led by Dr. Douglas Mombeshora. I think it's a progressive leadership in my interaction with them, because you need to have a policymaker who is able to give you an ear when you are saying something as experts. You need to ensure that the agenda to enhance public health or to advance public health is localized. It's actually cheaper and economically prudent for you to use local resources than for you to look at the global north always.
All right, cool. So as we round up, I want to ask about the Conference of Public Health in Africa trackers in 2023. Please explain for women by women.
Okay. That was, I think I would allow me to take two trackers that were intriguing to me. There was for women by women, public health services to young girls and women. I know, there are solutions that are usually put in place, but if they are not done by women, then they are not for women. We need to understand that the public health fraternity sometimes is affected by things that are hidden. You might be able to say people are resistant to health services, yet maybe the real issue is social gender-based violence, where someone is not even allowed. Those are like hidden barriers that we are not able to break until we understand from the victims.
True.
So for me, I really applaud it, because when we talk about public health, we're talking about behavior change. When we talk about behavior change, we need to know the drivers. Then allow me to speak about this one. I cannot leave the podium.
Please just make it short.
So the other tracker that I was intrigued by is unmasking the hidden epidemics, NCDs. You realize that there is a lot of diabetes issues, hypertension, obesity that has been going on, but people are silent about it. When people gain weight, people are just saying, you're gaining weight. People don't even understand that it's a public health concern. So I'm very happy that this conference in this year was able to address it in Africa, because back then the global south used to think it's a thing of the global north, but it has crippled in and it's happening here in Africa. So we need solutions for Africa by Africa to really look into our policies, really look into our diets, really look into our health situation as to how we stop it before it gets worse. Mental health is not spared, and obviously road traffic accidents, injuries are not spared in that as well. Thank you.
Okay. All right, thank you very much. I have one last question as we close the show, addressing the issue of cholera. How do you think this should be addressed, and what is it that should be done?
Okay, thank you so much, JB. I was waiting for that question. I would want to address it in such a way that you understand that cholera has always been one of the problems in Africa, and recently our first world country, South Africa, was also suffering issues to do with cholera. What it technically means is that we are having clean water bodies dwindling by the day. This is also as a result of rapid urbanization and poor urban planning. I would also want to localize it to Zimbabwe, a jurisdiction that I'm very much aware of. Zimbabwe needs to deal with its capacity to provide water to its citizens.
True.
Zimbabwe needs to deal with the issue to do with urban planning. We are having a lot of wetlands that are being turned into households. We are having a lot of garbage that remain uncollected, or garbage that are also kind of polluting our water. So we need to ensure that we advance our capacity, our vigilance in terms of access to clean water. Number two, we need also to learn from our experiences. Africa is not learning from its experiences, because cholera has been manifesting for a very long time. How do we use these experiences to inform our handling of potential cholera issues? So I think it's a matter of us looking at our public health system, the whole infrastructure, the whole policy environment. We have to look at it holistically. Our urban planning is really needs to go on top notch to ensure access to clean water. There's no magic to it. Access to clean water is an issue.
Not true.
Allow me to just add something.
You want to add something to it?
Yes.
Okay.
I think everyone,
short.
I think everyone has got a part to play. We've talked about what we expect from the government, but as individuals, I want us to understand that cholera is not a disease for the poor. Never think because I'm any better, I'm spared. So wash your hands, with soap and running water. Eat food at correct temperatures. Buy food from reputable sources where you really see I'm not a danger. So these are important things. Use the toilets. No matter what you think, let's just avoid open defecation. These are things that we can do as individuals to protect ourselves, though Retlo, of course, has talked about what we expect from the government, but as an individual, how are you protecting yourself?
All right, thank you. Thank you so much, Retro and Sfazo, for joining us, guys. We want to thank him as well. And please do not forget to leave a link in the description on Facebook channel, on our Facebook channels on Focus News 25. Please do not forget to like, subscribe. Thank you so much for joining us, guys. If you enjoyed, please do stay glued to your screen every time we air this program. From me, JTK, Jabulani Tulani Kumalo, it's bye-bye for now, and stay healthy.